Oftentimes I'll have a patient come in that maybe is kind of vague about their history and maybe not be able to tell me all the details. Maybe they've been in the hospital, maybe they've had recent labs. So it's been nice and wonderful actually to go into the SandlotConnect and actually pull up that patient and be able to look at recent x-ray reports, hospital records, in a lot of cases discharge summaries. It just really helps us fill out, kind of better round out what's been going on with the patient.
I'll tell you what it was like before SandlotConnect. You have to A, find the primary physician, B, look up the phone number, make the phone call. You may get the nurse, you may not. If you don't, you have to leave a message, and in that case, you know you're not going to get the records before the patient is gone. And if you do, then you have to wait on the fax, and who knows how long that'll take. Sometimes it doesn't come before the patient leaves, and so that leaves, you know, the doctor frustrated, and I'm frustrated because I don't have the records.
And so there's multiple layers of potential for errors in that situation. And so now by myself being able to access those records and actually look and see this is what I want to look at, I can print if I need to, or I can just look at those records right there and decide what's important, what's not important. Sometimes you might have someone on the other end that's looking at the chart and they're not sure really what's important, what I'm interested in looking at. And so maybe they don't send me something that I was most interested in looking at. So I can make that decision myself by looking at SandlotConnect.
I think our staff enjoy it as well because it makes their lives easier. They can communicate with a physician more effectively. They're not pulling charts and having to go through this labor-intensive process of copying and faxing documents. They have information when a patient calls. The chart is right at their fingertips so they can answer questions for the patients. So it has transformed their practice and their workflows as well.
Well, this is what I see from the patients when I walk in with a result. You know, it's a look of happiness because they can see what the result is, and then the doctor is able to go over it with them. So they're not just hearing, they can also view the information that's in the result.
This really is a system that the hardest part of it for me is just remembering my password because I'm getting old. And so once you log that in, it's a piece of cake. It's very easy to just put the information in of the patient and to access that information. A lot easier than any other systems I've used.
It was actually real easy. All you have to have is, you know, patient's name, date of birth, and sometimes if you have the date of birth and just the first couple letters of the last name, it just pulls it right up. So, I mean, it was a real easy learning experience from the beginning to where I didn't have virtually any problems with it at all.
And so now what my staff is able to do is to go ahead and access the information on SandlotConnect, and they can go ahead and just print it off and bring it to me. And often we can do it when the patient's right here in the office, which is a big time saver.
Being able to access SandlotConnect and look at those records that have been done recently, a lot of times we're able to not duplicate services, and that has got to result in dollars saved if you're not having to duplicate an x-ray or lab for that patient. If they've had big diagnostic tests, it's wonderful to be able to look at that and see exactly what was found and where we need to go from there. Do we need to do another test, or are we good? Do we not need to do any other testing per se, but maybe manage medications and follow up with the patient and do education of the patients?
Medicine is phenomenally complex. It's getting more complex every day, and the human mind just can't get around it. And we're at that position in healthcare where these information technology systems are going to assist us in doing that more safely, with fewer errors and better outcomes.